The ancient practice of Yoga Nidra, or yogic sleep, is a meditative state that exists between wakefulness and sleeping, often reached through guided meditation. This state is referenced in ancient Indian texts such as the Upanishads, the Mahabharata, and the Devi Mahatmya, and is related to both the god Vishnu and the goddess Yoga Nidra. Yoga Nidra is connected to the practice of meditation in various spiritual traditions, including Shaiva and Buddhist tantras, as well as in Hatha yoga texts where it is likened to a deep meditative state called samadhi. Contrasting with these traditional depictions, the modern incarnation of Yoga Nidra, as we know it today, has been shaped by 19th and 20th century Western practices of proprioceptive relaxation, practiced by figures such as Annie Pacencall and Edmund Jacobson. The contemporary technique, popularized by individuals like Dennis Boyce, Satyananda Saraswati, and Richard Miller, is now a global phenomenon, even employed by the U.S. military for PTSD recovery. According to scriptures, the term Yoga Nidra is used to denote the transcendental sleep of God Vishnu between cosmic cycles or yugas, and is attributed to the goddess Yoga Nidra. Furthermore, Yoga Nidra is associated with reaching a state of deep tranquility or gaining access to profound knowledge in Shiva and Buddhist scriptures. In Hatha Yoga and Raja Yoga texts, the term symbolizes a state of profound meditative consciousness, comparable to Samadhi by the 14th century. The practice is described as a state that dispels worldliness and eradicates a yogi's karmic bindings. Renowned yoga researcher Mark Singleton suggests that relaxation, a crucial element of modern Western yoga, has no links with ancient yoga practices. Instead, it owes its roots to proprioceptive relaxation techniques from the West, chiefly from the 19th and 20th centuries. Pioneers of this relaxation-centric approach include Annie Pacencall, known in her time as a relaxationist, and Edmund Jacobson, a psychiatrist from Chicago who championed progressive muscle relaxation and biofeedback in the early 20th century. In line with this theme of relaxation, relevant techniques include surrendering to gravity while laying flat, and focusing on releasing tension with the help of a friend to test and prove the state of relaxation. The idea is to separate the sense of self from the body, dissolving tension and creating a sense of life in the body without any strain. In 1973, Dennis Boyce authored a book in Paris titled Le Yoga du Sommeil Éveillé, Method de Relaxation, Yoga Nidra, The Yoga of Waking Sleep, Method of Relaxation, Yoga Nidra. This was the inaugural introduction of Yoga Nidra within contemporary context. The book incorporates relaxation techniques centering on the shifting of attention throughout the body. In its 1984 review, the French journal Revue 3 Millénaire noted that Boyce advocates relaxation to access the state of emptinesses. Through incremental shifts, relaxation gradually transitions into the practice of meditation, a state sustained once the mind shakes off preoccupation with external elements or thoughts. Satyananda Saraswati, a modern advocate of the technique, boasts experiencing Yoga Nidra during his time with his spiritual guide Sivananda Saraswati in Rishikesh. In 1976, Saraswati formulated a system of relaxation via guided meditation. Later gaining popularity during the mid-20th century, he defined Yoga Nidra as the mental threshold between wakefulness and sleep, exposing deeper mental facets. He associated it with the ancient tantric practices Vinyasa, tying mental fixation of Sanskrit mantras to body parts, thus engaging in meditation. Saraswati's own style includes 8 stages of practice. He implemented this method on his protege Niranjanananda Saraswati from the early age of 4. Yoga Nidra, as understood in contemporary times, is a state where the body is entirely at ease, gently guided into deepening self-awareness through a series of verbal directions. It differs from the focused single-point concentration of meditation. The practitioner of Yoga Nidra subtly pulls away from the usual interactions of their 5 senses, internalizing within 4 and maintaining a connection with the audible instructions. Swami Rama propagated a variant of Yoga Nidra that includes an exercise known as Eshavayatra, an inner voyage through the bodies, focusing one's attention towards 61 sacred points of the body during relaxation in Shavasana, corpse pose. As part of this practice, a further exercise named Shithali Karana is proposed to stimulate a profound state of relaxation. As preparation for the Yoga Nidra, this exercise also uses Shavasana for visualizing breath movements from the crown, coursing through various body points. The primary exercise of Yoga Nidra instructs breathing directionality while lying on the left, right side, and then in Shavasana, focusing attention sequentially on the eyebrow, throat, and heart chakras. The pioneer of yoga in therapy in the Western world, Richard Miller, furthered the application of Yoga Nidra for soldier rehabilitation, especially those experiencing pain. He adopted the Integrative Restoration, or IREST, method and collaborated with Walter Reed Army Medical Center and the Department of Defense to determine its potential effectiveness. He has been instrumental in introducing this practice to non-traditional settings, including military bases, veterans clinics, homeless shelters, schools, hospitals, hospices, drug dependency centers, and prisons. IREST became a useful tool for soldiers returning from Iraq and Afghanistan battling post-traumatic stress disorder, PTSD. The practice gained endorsement from the Surgeon General of the United States Army as an alternative therapy for chronic pain in 2010. In 2021, yoga instructors Uma Dinsmore, Tuli and Nirlipta Tuli issued a Declaration of Independence for Yoga Nidra Shakti. They expressed concerns over the commercialization of Yoga Nidra for monetary gain and the propagation of biased origin narratives that glorify the founders and neglect historical roots. They also expressed shock at abuses within such organizations, specifically mentioning Satyananda, Amrit Desai, and Richard Miller. They urged practitioners and teachers to understand the history of Yoga Nidra beyond organizational limitations and to forgo using the trademarked versions of the practice. Through studies, scholars have likened the concept of buddhis in Patanjali's Yoga Sutra to the intellect as expounded by St. Augustine and the Apostolic Fathers. Regarding Yoga Nidra, scientific investigation has shown varying results. Notably, a study by Parker 2019 observed the conscious transition of renowned yogi Swami Rama into non-rapid eye movement, REM delta wave sleep via Yoga Nidra. Astonishingly, Swami Rama's disciple showed the ability to produce Dita and the Titas Dila and the waves even while their eyes were open and they were conversing. In an attempt to address insomnia, Data and colleagues 2017 developed a therapeutic model involving Yoga Nidra, which showed promising results. Similarly, Yoga Nidra had a positive impact on the sleep quality of 45 male athletes in a controlled trial conducted by Data and colleagues 2020. Research, including exploratory and small-scale studies, have been carried out around several aspects of Yoga Nidra. One such study established an association between Yoga Nidra meditation and a boost in endogenous dopamine release within the ventral striatum of the brain. This inactive state correlates with decreased blood flow in the brain's prefrontal cortex, cerebellum, and subcortex, responsible for action control. Yoga Nidra was also noted to improve autonomic nervous system balance as measured by heart rate variability. This held true regardless of whether it was preceded by a Hatha Yoga Asana session. There have been informal suggestions about the benefits of Yoga Nidra, such as tension and anxiety reduction and a positive impact on symptoms of high anxiety like headaches, chest pain, palpitations, and more. Military veterans have been said to find relief from post-traumatic stress disorder through it. Additionally, a 2019 study proposes that Yoga Nidra can relieve stress and boost the self-esteem of university students. However, large-scale and strictly controlled trials are needed to establish these as solid medical benefits.